immunity is when your body is exposed to something. Let me start over. Natural active immunity is when your body is exposed to something, so it starts to make those antibodies. Artificial active immunity is what I showed on the board earlier, when we try to introduce the proteins. That is what the vaccination is an artificial active immunity. Natural passive immunity is the things that we see during breastfeeding, as well as the immunoglobulin G that crosses the placenta. Hello. Artificial passive is stuff that we take from one person who survived Ebola and put that into somebody else. They've created their antibodies, so we're going to use them and put them in somebody else.
How does that work?
What do you mean?
So what do? They draw blood, use
a plasma, and that's where we'll find the antibody.
And so, what does that process look like when they pull from the plasma? Is that like culture or what? Like, do they?
No, they don't have to culture anything. They don't have to grow anything.
They centrifuge
But they can use that material along with almost like a blank plasma to increase the number of antibodies that are made. Sort of the same way that you see in some DNA testing, it will increase the number of nucleic acids, so it makes it easier to read. It'll do something similar to that, but it's not going to like get a little bit and you're going to be able to save the world from it. You can only make so many. You can only create so many new antibodies from that, at least in the short term. I'm sorry, I was waiting for everybody to return, and I said 1 o'clock, and then they did not return. So we started with lecture.
I would have too. But you're a lot nicer than me because I lock the door and you go home.
Wait, I go home?
No, I go home,
Oh.
which means they in turn would have to go home.
Oh,
Yeah.
that is mean.
I'm a mean person.
You really are. We've all agreed on that, actually. We said that.
So I have a quick question.
Just 1 moment. Do you have the test grade?
I do.
I say we just push on with this lecture, and whenever everybody gets back.
Well, I want to give Danielle the opportunity to go back to what she was doing.
Oh yeah, let's do that.
That's why I kind of want to get
If you
the
want,
test
I
up.
have already created the packets for everyone to take home. If you would like me to hold on to everything and do a review of the texts, I can come back at 3. Do you want to push on to lecture until 3, or what do you want to do? I don't want to mess your day up.
Are they outside?
What is it?
One of 6, 7 or 8, according to
What does cell time say? Cell time never lies.
6, just like my watch.
I kind of wanted to do it in between this lecture, and then we still have to do gastrointestinal system today.
How much longer in this lecture? Do you want me to come
That's
back
what I
when
was
this
just
one's
flipping
done?
through. I've got about 14, 15 minutes for this lecture.
Do you want to just push on with that, and I'll come back when you're finished if you want to just
Would you mind?
finish out? Not at all. You're a world man. I live in it.
Thank you.
Everybody listen.
But I'm very serious when I say that if I start, coming back from lunch and I start lecture at 1 o'clock and you're not here, I lock the door and you guys go home. I'm counting against you if you're in the paramedic program. Dr. Sturgeon is a lot nicer than me. A lot.
I am.
Is anybody else confused as to why we had that lecture? I got.
Well, now we have to be on time, even though we already are, but.
Ian, what was your question? I'm sorry.
What were we talking about?
The plasma and the
Plasma.
Virus.
Oh, so, that process, getting the antibodies from the Ebola people, that would not work for HIV then, right?
Correct.
That would be different in every person, it would change
It's gonna change, it's gonna be so different. And then, I mean, there's two different types of HIV, I don't know if you know that, HIV-1, HIV-2. But that, in that case, it does not work because the body doesn't have any antibodies. They can't make antibodies, they change their symptoms.
For Ebola, taking the plasma of someone that died from Ebola wouldn't give you anything. Because the body didn't make any.
No, it does make
antibodies.
antibodies, but it's not gonna be nearly the extent we were seeing some other virus like influenza. Because again, we have a virus that doesn't have his receptors out in the open. So it makes it difficult for an antibody to latch onto it. So putting them in, it only has a minimal effect anyway. But it's one of the main treatments they've been using since the initial outbreak in '76. Yeah. And they can only make so many more antibodies from that group. So it's not terribly effective, but it's something. So this is where coming up with a vaccine for Ebola is difficult, because if those Y-shaped antibodies are supposed to be locking onto a receptor, how can they lock onto a receptor if the receptor's covered up?
You'd have to figure out how to express to get that cover off, right? To mimic that change that happens when it gets inside the cell and releases it.
Inside of the lysosome, yeah, inside of that vesicle. How does it know? I have no idea how it knows what's in there. Obviously, whatever chemical is in that particular lysosome is a trigger, but I have no idea how that is. So then there'd have to be a two-step process. Step number one would somehow remove that cover. Step number two, have the antibodies that would bind to it. All right. Let's see, 14. Cellular immunity, humoral immunity. Cellular immunity means cells, includes the cells. Humoral immunity are the things that are found in the blood. Big picture. All right. Immunodeficiency disorders, we've already talked about a couple of those. Or at least mentioned a couple of those. HIV being the most obvious. SCID, severe combined immunodeficiency. Common variable immunodeficiency. Bruton's agammaglobulinemia. The George syndrome, I think, falls under that as well. Thymic aplasia is going to create an immunodeficiency. Autoimmune disease disorders, what does that mean? Autoimmune disorder means the body is making a mistake, right? If the body's making a mistake, it's attacking things that it thinks are foreign but are not foreign. It's destroying your own tissue. It's destroying the cartilage and connective tissue around the joints, which is how we end up with rheumatoid arthritis. Multiple sclerosis, destroying the myelin. Remember that myelin that covers the axons? If you destroy that, then the signal doesn't get transmitted down to the muscles. Systemic lupus erythematosus, all over the place. Hence the term systemic. Type 1 diabetes, beta cells in the pancreas. Type 1 diabetes. It could be autoimmune, it could be viral. A virus could have caused the destruction of those beta cells. Why do I say it could have been viral?
So we don't know.
Because we don't really know for sure. So who can we blame for that? Which one? Epstein-Barr. Why not? Myasthenia gravis. We've seen this one. Myasthenia gravis destroying the receptors on the muscle fiber. So the nerve is fine. The acetylcholine release is fine. Choline esterase is fine. Even the muscle itself is fine, but the problem is it's getting a very weak message. Graves' disease, hyperthyroidism. Graves' disease is hyperthyroidism. Addison's disease is hypercortisolism. cortisolemia, too much cortisol. Hypersensitivity reactions, those are like the allergic reactions. Immunodeficiency, if a person has an immunodeficiency, that means their immune system, the one that we have that's keeping us alive right now, day to day, is going to cause them to die. And remember, it doesn't just fight off things that enter into our bodies. What else does it kill off?
The good stuff inside our body.
Like what?
Your healthy cells.
Well, we don't want it to. What other bad things happen in our bodies? Cancer. So if a person has an immunodeficiency, are they more likely to have cancer? Of course. Kaposi sarcoma. Kaposi sarcoma is a skin cancer that they saw in those HIV patients. Very rare otherwise. This was one of the things, thank goodness, this was one of the things that helped the researchers, helped the doctors figure out something was new. Because of Kaposi sarcoma, as well as the infections of Pneumocystis carinii, which is now called Pneumocystis jirovecii. Because of these, the doctors realized that this was something new. Here we had previously healthy 30-year-old men, in other words, never had a history of an immunodeficiency disorder, suddenly getting diseases that were only seen in an immunodeficiency disorder, which means they must have acquired an immunodeficiency disorder. Does that make sense? So thank goodness for Kaposi sarcoma and Pneumocystis carinii, now Pneumocystis jirovecii pneumonia. Because without those, the researchers would have missed it. The doctors would have missed it. It would have taken longer for them to figure out that there's something new. Immune-compromised patients include those with AIDS, SCID, that's a severe combined immunodeficiency, leukemia, some anemias, chemotherapy patients, and those taking immune-suppressing medications after organ transplants. Because remember, if somebody has an organ transplant, are they going to get an exact match? No, they're going to get something close. If it's a close match, there's only a small attack. The bigger the difference, the bigger the attack. So if it's really close, then there's only going to be a small attack, so that they're going to have to use medications with to suppress. Chemotherapy patients are, of course, going to destroy some of these cells, these rapidly dividing cells, because isn't that what chemotherapy does? It destroys rapidly dividing cells. Isn't that what cancer is? A bunch of rapidly dividing cells. So if you're destroying the cells that are going to help out with the other infections, the other white blood cells, then of course we're going to see patients getting sick. Now look at leukemia. This is why those nurses and healthcare professionals, when you ask them what is leukemia, they'll say it's a cancer of the white blood cell, and I'll ask, well, what else is it? And they'll say, well, it causes people to get sick more often. And you'll ask why, and they'll just sort of look at you like, that's what they taught us in school. You understand a little bit now, though, right? That these are white blood cells that are wrong, that the directions on how to make them is wrong, which means the body doesn't have the number that it needs, so the body starts asking for more. When it sends that information, that request to the bone marrow makes more, but it keeps making wrong ones. And the body keeps requesting more cells, and the bone marrow keeps making wrong ones. Which is why when you take their blood, you look at a blood smear, you don't see one white blood cell, you see 15 or 16 white blood cells. And they're all wrong. They look weird. They're incomplete. They're immature. There's something different about them. And they don't do what they need to do. And now the body spent so much energy making those, it's also now low on the other white blood cells. So the immune system is down. If somebody has an autoimmune disease, look for another one. Because if they have one, chances are they have more than one. So anytime somebody's diagnosed with any autoimmune disease, there's probably 2 or 3. Because remember, when you take a shower in the morning, you use hot water and you use cold water to make that perfect temperature. You have to have this balance. Remember, we have a clotting cascade to make clots, but we also have things that release heparin so the clots don't get too big. So there has to be a balance. We have the suppressor T cells to help keep everything in check. So if there's a person who has an autoimmune disorder because something is making a mistake someplace, that mistake was probably part of some other pathway as well. Or that cell that might be the one that says, stop doing this, might be absent, or might be in low numbers, which means he could also be the cold water to somebody else's pathway. Allergies, allergic reactions, hypersensitivity. We know what this is, right? This is when the body does what it's supposed to do, but goes overboard. As I said, this is like the guy who steals the candy bar from the gas station, and the SWAT team shows up with the snipers and the helicopters. Just going overboard. Yes, you want police there, but not like that. So if I walk out into a field where there's a whole bunch of pollen floating through the air, my eyes start watering, I start sniffling, my nose starts running, my face starts getting puffy, I start getting a little itchy, and you're walking right next to me and you feel fine, does that mean your body's not having a reaction to it? Because you're in the same environment, right? You're getting the same pollen sucked up into your face. The difference is your body is saying, okay, we do need to make more mucus because we do have a whole lot more particles in here, but we don't need buckets of mucus. So we don't need a whole lot of volume of fluid going there. So we don't need a whole lot of release of histamine. We'll just make a little bit more to trap these things.
Do you build up a tolerance to something like that?
Not so much a tolerance, but you can change. You can have an allergic reaction that gets less and less over time.
Okay.
You can also not have an allergic reaction that can be created over time. So it can go both directions. You may have never been allergic to cats before, but as you get older, you're suddenly allergic to cats.
But it's not like you can take a proactive stance against it. I'm going to slowly expose myself to cats.
Cats and rubbing on your hair. No. No, because you don't know for sure. Your body might go the other direction with it. Because sometimes you'll hear about people who have gotten stung by so many bees, like beekeepers. They'll say, I've been stung so many times, the doctor says if I get stung one more time, it'll kill me. It's because their reaction to it has gotten larger and larger and larger over the years. But there is a possibility that a person can earlier in their life be allergic to something and then later not. Systemic hypersensitivity, anaphylaxis, stimulating chemicals throughout your body causing vasodilation, leading to dangerously low blood pressure and heart failure. How are you going to raise that blood pressure? Vasoconstriction. And what medication are you going to use? Which works on what pathway in the central in the nervous system? Parasympathetic or sympathetic? Hives. What's the other word for hives?
Urticaria?
Urticaria, urticaria. All of those are correct. Notice the degranulation of the mast cells, releasing histamine, causing vasodilation, vasopermeability increases, etc., etc. An allergic reaction is exaggerated response by the immune system. It's the immune system doing what it's supposed to do, but way too much. Sensitization occurs upon the initial exposure. We see this in something like poison ivy. Delayed hypersensitivity in poison ivy. Examples of immediate hypersensitivity include common allergies such as hay fever, drug allergies, food allergies, eczema, and asthma, usually due to IgE. Drugs, food, animals, insect venom, fungi, and molds, and contrast materials. This is why, if you go to the doctors, or if you take your child to the doctors, and they give them a shot of penicillin, or you get a shot of penicillin, what do they say? They say, wait, hang out here for 5 or 10 minutes, 15 minutes, 20 minutes, just to make sure that you didn't have a reaction to it. How's the reaction going to show up first? What part of the body?
Your skin.
Even if it's going to be an anaphylactic reaction, it'll show up in the skin first, very, very quickly, in the form of a rash, or maybe edema. You can see their lips will swell up, the face will swell up, tongue will swell up. Histamine, we talked about that. Bronchoconstriction, vasodilation, increased intestinal motility, increased vascular permeability, which means more fluid is going to be leaking out of the vessels, collecting in the tissues. Vasodilation means more blood and more fluid to an area. So all of those cells that make mucus, of course a big component of mucus is water, which comes from our plasma. So if we open up the pipes and send more blood to that area, we're sending more plasma to that area, which means send more water to that area, which means those cells are going to make more mucus. Does that make sense? Couple that with bronchoconstriction, that smooth muscle, in an area where we have cells that produce mucus. You see how that can create a problem. Intestinal motility, you can end up with some diarrhea. Foreign proteins, horse serum. Where do we see horse serum? Who's going around drinking horse serum? That they're allergic to it.
We grow that in
They use it to make vaccines.
Black widow spider venom, anti-venom.
Tetanus. Tetanus is a big one. It's made of horse venom. Some horse venom. Horse serum. Those are the worst horses. Yeah, that's one of the big ones. Still uses horse serum is tetanus. So somebody's allergic to it, obviously. You're gonna find out if you give them a tetanus shot.
Why?
What do you mean? Why is that?
Why do you use horse serum?
Why they chose that over eggs, I don't know, because eggs are also used in some cases.
That's used in the food shot a lot, isn't it?
Yeah. But why horse? No idea.
You might be able to develop
Why
different
someone
antibodies.
more similar to humans if they're DNA cultures to humans?
Because it doesn't really make a difference, we're using their serum. We don't have to worry about it, stuff like that as much. But why horse? I don't know. Why horse and not cow? I don't know. Why horse and not donkey? I don't know. Why horse and not unicorn? Self-explanatory. Well, shrug your shoulders like I don't know. Yeah, you know. It's not unicorns.
We use horses for the black widow spider anti-venom because they don't get the symptoms. So we're infecting them and they create the antibodies, but they don't get sick from it, as opposed to everything else.
Yeah, but why horse and why not chimpanzee?
Because their antibodies are different and they like
Yeah, but
the,
chimpanzees, we're much closer to chimpanzees. Why not use that?
because they probably get sick, and who wants a sick chimpanzee?
Look at the poor chimpanzee.
Who wants a sick horse?
Who
The
wants a sick
horses don't
horse?
get sick. The Clydesdales, they like it.
They like it.
Because of Mahan.
God, what are you doing
Well,
at
then,
work?
okay, then why not cows?
Because they get
they're
a
delicious.
response.
They are delicious.
They're delicious.
Cows get a response, but horses don't, really?
Yes. I bet they're training.
I don't know that. I don't work with animals, so I have no idea.
They use Clydesdales, because apparently there's other types of horses that do have a response.
Huh. Otherwise, are horses.
It's more than a small beer.
Because they're drunk.
Because we get them drunk, yes.
I want to read about that, so that's interesting. Now you got me wanting to know more, wanting to understand it better.
I'm full of spiders.
Why is the gastrointestinal system such a big part of the immune system? First of all, gastrointestinal system.
Part of getting rid of weight. You have the stomach acid that can kill it if it's ingested.
Yeah. Well, first of all, don't we have a big giant tube that opens right here, and that goes straight down into our stomach. Now, our esophagus is a flattened tube, but it still has a passageway. So, think about all day long how many times you eat and drink things. Do you have any idea how many pathogens you're putting in your body as you're eating and drinking things? How much bacteria was on that hamburger that you ate for lunch? Or those fries? Or when you picked up a fry with your fingers and put it in your mouth, what did your hand touch just before that? Was it on your cell phone? If it was on your cell phone, what did it pick up off your cell phone? Because your cell phones are filthy. So all that bacteria transferring into your mouth, you want to do something with it. So you want to have something really strong that's going to wipe it out. So not only do we have the mucus that's going to help trap things, we have this really strong acid. We also have a whole bunch of lymphatic tissue in the area called Peyer's patches. It helps to get rid of it. Ah. All right. All right. Looks like we're done. This is tough stuff, man. This is complicated. I would recommend that you read this chapter 2 or 3 times. Before we start this, though, let me get your test back to you.
I was like, excuse me?